Hello, everyone. Thank you so much for being here today in our Practicum Showcase. I'm just going to give a few more moments and then we will begin. Okay. Hello, everyone. Thank you so much for being here today. On behalf of Child Family Health International, it is a pleasure to be able to be here and to host our Practicum Showcase. Child Family Health is a nonprofit organization that offers ethical, fair trade, global health learning opportunities for students and academic institutions. And these programs include practicums, which is what we will be focusing on today. CFHI has a unique approach to global health education in which we emphasize existing health systems and existing resources. We hold up local practitioners as experts of their own environment. We focus on positive assets and efforts that are existing within communities, and we practice fair trade learning and partnerships, and this carries over to our practicums, which is what we will be focusing on today. Now, what exactly is a CFHI practicum? Our practicums differ from the rest of our programs because students are carrying out a project with one or more deliverables. And whatever the experience may be, it is a structured, supervised, and evaluated professional experience that allows the student or the trainee to develop different skills and to also fulfill different requirements. Each practicum is tailor-made for the student with three different very important things in mind. Of course, academic requirements such as what competencies must the student develop during the practicum, student interests. So for example, are you interested in health promotion? Are you interested in education, epidemiology, research? And very importantly, what our local partners are doing and how the student can fit into the ongoing efforts. And all of this creates the practicum outline that the student will have before the practicum begins. Whatever your project may be, it will possibly fall under one of these areas, such as continuing quality improvement projects, capacity building, or co-education. It might be a reciprocal innovation analysis, a program evaluation, a critical reflection portfolio, a case study compendium, a literature review, or a no-do gap. We're going to learn more about two specific projects today that fall under the continuing quality improvement projects, but this allows the trainee to have a process in which they have to gather information from different stakeholders, do an extensive research, and be able to thus contribute to ongoing efforts. We also will hear a little bit about a critical reflection portfolio, which is done in parallel to other deliverables and other project areas. And this allows for the trainee to develop professionally and personally and have reflections on areas such as social justice, global health education, inequities, and others. What exactly it is the student will be doing is determined with the team beforehand, but these deliverables might be something such as a grant proposal or a policy brief, culturally competent educational material. It might be a literature review, an informative video, or an evaluation plan. And all of this is determined before the program begins, and the student is aware of this before they travel, or in case of a virtual practicum, before it begins. Now, today we have the opportunity to hear the experience of two practicums that happened this summer. One is of Fan Hu Huang, who is a medical student and a CFHI Practicum scholarship recipient. Fan did a global health practicum in India just this past summer, and the name of his project is Strategies to Enhance Palliative Care Access in Rural Populations and Increase Awareness in Life-Limiting Illness in India. Before we hear about Fan, it's very important to contextualize, and we have Hema, who is our medical director for India, here with us today. So Hema, thank you so much. We have a short video from Can Support, which is the organization that Fan worked with. Can you tell us a little bit more about this process and how did you find Can Support to be the best fit for Fan?
Yeah, sorry, I was unable to unmute. Yeah, hi. Good evening, good morning to everyone. So when I received the request from Fran, like from Juliana, that this is the student and he is interested in a practicum. So I generally talk to the organizations in advance and keep the practicums ready. And I had some of the subject areas ready already with me that I shared with Juliana, and Juliana shared all those practices. So we ask for the practicums from the organizations which are mutually beneficial actually. So they send us the practicums where they feel that the students could be helpful in achieving their objective. And at the same time, it's a learning experience for the student. So I shared these practicum subject areas with Juliana, and in turn, she shared with Fan, and Fan picked up, I think a few of those. And then I went back to the organizations, and I went back to Can Support and asked, which one do you think is most beneficial for you, for the student to help you with? And they picked up one. So that is how we actually started working on it. So yeah.
Thank you so much, Hema. And we're going to now hear about Can Support itself and learn more about what it is they do and more about what Fan did. And then we will hear it from Fan himself.
At Can Support, our primary focus is on providing palliative care to patients with life-limiting illnesses, particularly cancer, while addressing key challenges such as managing complex symptoms, ensuring access across diverse populations, and navigating the underutilized public health infrastructure. Our priority is capacity building, advocating for palliative care, integration, and enhancing the quality of life of our patients. During the practicum, the student made significant contributions, notably in research aimed at improving access of palliative care in rural areas and raising awareness of life-limiting illnesses in India. This research is crucial to our mission of extending care to underserved communities, and it will shape our future outreach and policy advocacy efforts. The collaboration between students, staff, and stakeholders enhance these outcomes, fostering a dynamic environment where mentorship and fresh perspectives lead to effective care delivery and research advancements. We are committed to sustaining and building upon the students' work by integrating the findings into our ongoing projects and ensuring that the impact is long lasting. Thank you.
So now that we have heard about the perspective of Can Support, the organization that Fan completed the practicum with, Fan, would you be able to tell us a little bit more about your experience? Thank you so much for being here today. So Fan, you are a medical student and you won the CFHI Practicum Scholarship. Can you tell us a little bit about yourself and also a little bit about developing this practicum? Emma mentioned that we gave you some options. Can you tell us a little bit about how that fit in and how it is that we developed this practicum?
So first of all, good morning and good evening to you all. I am Phan, a fourth-year medical student, came from Vietnam, and as I know of, I'm one of the first medical student in my country to actually receive the Practicum scholarship and to have a chance to practice in Delhi. So it's truly an unforgettable memory for me. And thank you to Dr. Juliana and Miss Madeline and also Miss Hammer for helping me a lot through my application and as well as my time at the practicum. So at first, I didn't think that the practicum would offer such a well-tailored goal towards my needs because uh, as I know of exchange program for like medical students or any healthcare students are relatively uh, uh, less seen often, and I really appreciate that I had this opportunity. So about my project at Can Support, um, I worked with Dr. Ishita Gandhi and wrote a research article named Strategies to Enhance Palliative Care Access in Rural Population and to increase awareness in life-limiting illnesses in India. So the manuscript is finished and being submitted and for peer review on Elsevier Geriatric Nursing Journal, and it's a very good journal, I think. And we're in the peer review process, so let's hope for the best result.
Thank you,
But
Fan.
through this project, I had the chance to reflect the current state of palliative care strategies being implemented here in India, and as well as the models and the initiatives that needs more attention in the future. And I discovered that while India's unique demographics has led to its highly adaptive home care models through like private NGOs such as Care Support here, and through public health provided by the global governmental sector still lack quality and appropriate resource allocation. And of course, I also learned that the asset-based approach in healthcare delivery aligns very well with CFHI's practicum goals. So that's very nice finding. And Dr. Ishita Gandhi and is a co-author of me, and she helped me a lot during the writing of my manuscript. And during my time at CancerPod, not only did I develop academically, but I also expanded my perspective on how different nations with distinct characteristics deal with this its population problem in healthcare. And of course, the I think one of the greatest benefits when doing this project is the flexibility that I have through being able to both work at the office of Can Support and online from my laptop. So I both had the time to go and explore and travel, and I also had the time to um, receive training and suggestions from Dr. Ishita, which was very great.
Thank you very much for that, Fan. So, can you tell us a little bit more about these interactions? You had the interaction with your mentor, but did you also have the opportunity to understand the healthcare system? You had the opportunity to go out and understand through going to NGOs and different clinics. Can you tell us a little bit more about that, please?
Yeah, so Cancel Pause was my plan for my first and second week. And uh, during my third and fourth week, I had rotations at the shop's charity eye hospital. I learned about the clinical aspect of ophthalmology and the educational program for the blind and the visually challenged. So we actually learned a lot, and we um, apart from go on rotations and do some clinical work, we also have the chance to like visit more places to monuments and history places such as the our fort, the Taj Mahal, which was a very nice experience for me. And we also have had a chance to go to Missouri and the Lotus Temple, which was a very diverse experience where every place is a different environment and a different weather. So I feel like I'm traveling to different countries even. And apart from that, we also had Hindu lessons and public health lectures at home during the practicum, which also help us to um, culturally and professionally prepare for our program, which is very meaningful.
Thank you very much, Fan. Before we pass over to Hema, who will tell us a little bit more about Can Support, Fan, can you tell us a little bit about what skills or what strategies do you think you developed the most during your practicum that will be helpful for the rest of your career as a healthcare provider?
So one of the key skills that I developed during my practicum was flexibility, as I mentioned, and adaptability, particularly in the fast-paced environment of New Delhi. So navigating through the um, fast-paced city and adapting to the unique dynamic healthcare settings required like quick thinking and a proactive approach. So I learned to adjust rapidly to changing situations. And of course, India is um, not a place for beginners, in my opinion. And it has a very fast pace, and all the people there um, they have like a lot of culture intertwined with their um, everyday life. And I also had the chance to enhance my problem solving skills, but um, and also improve my ability to like adapt to high pressure environments. And I think it's a crucial skill or competency for any medical professionals.
Thank you very much, Fan. So now we're going to head over to Hema. Hema, we've heard a little bit about Fan and his project around palliative care, but can you tell us a little bit more about CAN support, about this organization that CFHI partners with, and that you as the country director find this best fit?
Yeah. So CAN Support actually was founded in 1996 by a cancer survivor. She was a doctor, and she started CAN Support because she understood the importance of, palliative care with the cancer patients. Although they now work with non-cancer patients at the end of life as well, but it is mainly dealing with the cancer patients. And so they provide them counseling, they provide them treatment, they provide them, nursing care. And most of all, India is a very, like, there's nothing to fear about, but India is, in a way, is very complex country where it is difficult to understand the government schemes and policies, what are in place for the, people, especially the cancer patients who are already, the families are already dealing with the pain of the patient. And, sometimes the patient is the only breadwinner in the family. So they also help the patients and their families to get connected to these schemes. And now, and in India, the schemes are there from the central government as well as from the state government. So they educate them, they help them get the benefits of these schemes. They help them, make the informed choices. And then, they help them with physical, emotional, social, spiritual support. They run daycares for the patients, like they have a daycare for kids, they have daycare for adults. And in these daycares, they do provide counseling, they provide meditation sessions, they calm them down. And people who can come to the daycare. Otherwise, there are more than 30 teams that serve in and around Delhi, and now they are expanding to different parts of northern India, especially. So each team has a doctor and a counselor and a nursing staff. So they go from house to house, and Fan had the opportunity to actually accompany some of the home care teams and did the home visits with the teams.
Thank you so much for this, Hema. And this is an organization that has been in India for many years and will continue to do so. And I would like to emphasize that the research that FAN contributed with is something that will be continued to be built on. And as a colleague from CAN Support mentioned in the video, will continue to contribute to the benefit of the patients and of the people that use the services. And this is something that is very important when we talk about CFHI practicums. We always strive to make them relevant, to make them sustainable, to be something that can continue to be built on. And this is a great example. We look forward to seeing that publication, Fan, and thank you so much for being here today. So now we're going to step over to another continent completely, and we're going to talk about an opportunity that was presented during this summer for Victoria Francois, who is a master's in public health and a doctorate in public health candidate from the Pennsylvania State University, who had a practicum experience this summer in Ghana. And the name of your practicum, Victoria, is Interventions to Improve the Capacity and Services of the Econ Chips Compound in the Central Region. Thank you so much for being here today.
Hi, everyone. Good morning. It's so good to be here, or good afternoon, or good evening, wherever you are.
So before we hear about your experiences and we learn about hands-on from you, what it is that you did, we have a video from Dr. Charles, who is our medical director in Ghana, who also tells us a little bit about how this practicum was created and how it will also have an impact. So we're going to watch it, and then we will hear Victoria's contribution.
Hello, everyone. My name is Dr. Charles Chitemewubu, the Medical and Program Director for Child Family Health International Country Branch in Ghana. I'm here to share my experience and provide some kind of practical support for one of our students who actually had an amazing time in Ghana and was able to work on her practicum. That was Victoria Francois. And I'm just going to start by talking about the overview of the site of where she had her practicum. So first of all, Victoria had the opportunity to come to Ghana, to the central region of Ghana, and she was in a community in the central region called Ekon, where she was in the CHIPS compound, which is more what we call the Community Health-Based Planning Services Center. So this is like a lowest level of healthcare in Ghana, where you have some kind of small center with community health workers and which are kind of primary care nurses who cater for the community in terms of primary care services, referral services, vaccination services. So it's the lowest level of the healthcare system in Ghana. And we have so many CHIPS compounds scattered in so many remote areas in Ghana. So our students had the opportunity to be placed in this center, learn about this compound and the challenges in this compound. So the unique approach we took, it was very, very important for the student to know a lot of the evidences about the CHIPS compound. So the student has to do a lot of reading, literature review to understand some of the challenges and the current issues that are facing some of this CHIPS compound in Ghana. And apart from having that, published literature review evidence that she was able to absorb, she was also able to come and experience this CHIPS compound by learning and listening to the staff and listening to their concern and challenges. And she was able to merge this evidence and this reality, bring it together to create a project and grant proposal. So there was a lot of evidence-based approaches, which is very, very important in public and global health. There was a lot of, working with the vulnerable population to understand their needs and working with the grassroots that are involved in the, population to understand the needs of this primary care center. Most of the key contributions our study students made was providing an ear to listen to the concept of these people, because it's very, very important, sometimes to place somebody more like a mini auditor to kind of listen and, report back to understand some of their needs, because there are lots and the priorities and there are a lot of issues in Ghana. Sometimes, people feel that they're not listened to, including the healthcare workers. They are also overworked. So a kind of listening here can be helpful. Also, to be able to work with them to create something that can be a prospective project was also very, very important. So we have the importance to kind of document, what is necessary based on evidence and based of interactions with staff on the CHIPS compound. Now, and there was a whole collaborative impact, because this student was here to build up competencies in order to complete her postgraduate. I think she was doing a Doctor of Public Health. She wanted to also exhibit leadership competencies, which I believe she did. And she wanted to also have that public health experience with a mentor who can guide. And I think she was able to meet a lot of this. And one thing she was able to do was to actually reflect on her experiences, using a framework and actually doing evidence-based reflection. So not just creating a proposal based on evidence under my supervision, she was able to reflect on her experiences and plan ahead, on a way to develop herself towards self-development. And this was very, very important also. As for sustainability of the efforts, the fact that we've gathered all this information is very, very important. And it's something that can be the next step in providing the kind of support we need over time as we generate funds from our global health programs. So now that we've identified some of the needs and we have it in a proposal, we can actually, build up something prospective that we can plan and support our partnerships with some of these sites. It also presents opportunities for other students to come in and also identify some other challenges and work with these people and collaborate in so many ways. And, it's been a great experience working with this student. And I'm glad she got the opportunity. She was an amazing student. She got the opportunity to also learn a lot about the culture. You understand, visit a lot of places in Ghana. You understand, and build up a cultural competencies, understand the importance of contexts when drafting and making initiatives, because a lot of times when she was drafting, she had to remove the skills, of being in the US context and imbibe herself in the local context of Ghana on how things are done, how things will work, and understood how the needs are important and how the needs are contextual. And even though there may be similar problems, the way to address it might be different, because even this staff, based on how they are trained, how they work, a whole lot of things are different. So I believe it was a transformational experience for these students. And definitely we are looking for more students, not just in this site, come and participate in some of these practicums in other sites. So it's been a great experience. And we are glad for the partnership with the institution, and we are looking forward to so many other students to join in this practicum. So thank you very much. That's all for now.
So, Victoria, we've now had the opportunity to hear a little bit of Dr. Charles. He gave us a tiny little bit of context, but can you tell us a little bit more first about yourself? What led you to be interested in completing a practicum with CFHI? How was it developed? And can you tell us a little bit about those competencies and those skills that you developed in your practicum and your time there?
Absolutely. So hi, everyone. Again, my name is Victoria Francois. I am a DRPH candidate at Penn State, and DRPH, as Dr. Charles mentioned, stands for Doctor of Public Health. So it's similar to a PhD program, but we focus more on practicum experiences in the summer so you can gain more practical public health knowledge. So I'll still be completing my dissertation and everything like that. But for now, I'm just also working on how can I translate some of the skills that I'm learning in my courses to more practicum public health experiences outside of the classroom. So I am really passionate about social justice. And when I was learning more about all of the different injustices that were happening in the United States, I wanted to also have the opportunity to expand my understanding and knowledge of health and equity just a little bit broader. So one of my mentors connected me to CFHI because she knew I was looking for a practicum experience. And it was just the absolute perfect fit. I wanted to go to Ghana because I've never been to Africa before. So I thought that would be a great opportunity just to be immersed in a different culture, in a different country, and just learn a little bit more about how healthcare is done in a completely different location. So this was a really great fit for me because my concentration is community and behavioral health. And as Dr. Charles mentioned, I was in Cape Coast, Ghana, which is about 2 or 3 hours from the capital of Accra. And I was placed in the CHIPS compound, which has been the primary healthcare strategy in Ghana since 1999. And it, again, provides community-based health services, and it is oftentimes the primary health primary form of healthcare for remote community members in Cape Coast, Ghana, and also other regions of the country as well. Some of the competencies that I was looking to kind of address in my time in Ghana, they were all in alignment with the competencies that I had for my program. So I wanted to learn how to propose strategies for health improvement and elimination of health inequities by organizing stakeholders and interacting with different community members to identify health needs. I also wanted to learn how to communicate public health science to diverse stakeholders, including individuals from all levels of health literacy. I wanted to integrate knowledge of cultural values and practices in the design of public health policies and programs. And I also wanted to, again, learn how to engage the critical stakeholders in the planning, implementation, and evaluation of public health programs. And I think I was able to meet all of those competencies really well during this project, especially because I had the opportunity to meet stakeholders from all different walks of life. I had the opportunity to speak to the staff members in the Econ Chips compound, but then I also had the opportunity to just have conversations during our weekly lectures with our medical deputy director, I think that was his title, as well as our local coordinators. And so all of those different stakeholders just gave me a really robust picture of how the Ghanaian health system is composed. So yeah, it was awesome.
Thank you so much for that, Victoria. And can you tell us a little bit about how it contributed to your personal and professional growth? You mentioned it was a good fit. Can you tell us a little bit more about this, like the expectations and all of this part?
Yeah, absolutely. So it was, oh my gosh, it was amazing. I'll probably never stop talking about it. I think it contributed mostly, so I'll start with my personal growth first and how it kind of transforms my I don't know, just like the way that I view public health now. I think by being in the CHIPS compound for 4 weeks, I had the opportunity to shadow a variety of healthcare providers and just learn more about them and how they came to the CHIPS compound and their kind of like their career trajectory. And I also got to observe how they care for their patients. And when I was there, I really got to see how they value health education, like as they're caring for their patients. And I got to observe firsthand how important it is to have trust within that provider-patient relationship and how the quality of care is improved when you have that level of trust, because these community health workers that I was shadowing, they really were like integrated into the community members trusted them, and they really like listened to their whatever was going on with them. And it was amazing because when you're over like in the United States, I think especially if you are a person of color, a lot of times when you don't have that level of trust, and that could be for a variety of reasons. It could be because of implicit bias. It could be you just don't know like your healthcare provider that well, or your healthcare provider isn't spending enough time with you. So that it was just a huge difference. So that was something that I was really thankful to be able to see, because that's not something that I've experienced over here in the United States. And then I also just learned more about how community health is conducted in Ghana, and well, how community health is conducted in general. This is my first time being able to see community health work in action, because I've done a lot of reading and researching and all of the things, but I was able to actually see what community health looks like in a different country, and it was awesome. And then I also was able to see how health equity can be shaped by government involvement. Again, the CHIPS compounds are I think Dr. Charles mentioned it was one of the lowest levels of healthcare in Ghana, but I could also see in the literature how the government involvement could definitely help with providing more resources and things like that to improve the CHIPS compounds throughout the country.
Thank you so much for that, Victoria, and thank you for sharing about your practicum experience. And I look forward to working with you next summer with another practicum as well. So thank you so much for that. And just to close off about practicums, and thank you everyone for being here. I'm very happy to be able to discuss more with you. We have practicums that are both virtual and place-based, and we also have a hybrid modality if you are unable to travel for at least 4 weeks. It's important to note that all of our practicums are at least 4 weeks so that you can really understand the context, be immersed, talk to stakeholders, all in parallel to, of course, conducting research and evidence-based practices. It's important to note that no matter which type of practicum or which site it is that you will work with, you will be receiving a custom project created with the asset-based approach that we have talked about here today. And well, if you have any questions or any comments, please feel free to reach out to us. Here is our website, and as Practicum coordinator, I'm very happy to meet with you and discuss what site might be the best fit for you. So thank you all very, very much for being here today and for your time.